Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio, and I'm real glad that you could join us again. You know, the COVID-19 pandemic has caused many Americans to delay their health screenings. Now, January is Cervical Health Awareness Month, and every hour, one woman is going to be diagnosed with cervical cancer here in the United States, and there are worries that this may increase due to, as I said, delays in screenings. Well, OBGYN and best-selling author of Queen V, Dr. Jackie Walters, is joining us here on Health Professional Radio today to talk with us about cervical cancer screening. Welcome, Dr. Jackie. Thanks for taking the time.
Hello. Thank you, Neil. Thank you for having me.
Give our listeners a brief background, and then let's talk about cervical cancer.
Yes, Neil, I am an OBGYN that I have been in this area for 20-plus years, TV personality, and I've written a book for all women and men called The Queen V.
Who does cervical cancer affect the most?
Great question. Cervical cancer can happen to anyone. Like you said earlier, every hour, one woman is diagnosed with cervical cancer. And my concern as an OBGYN and as a woman is this number may increase due to the delay in screening because of the pandemic. Even more alarming to me as a woman, as an OBGYN, and as a black woman is African Americans are more likely affected than any other racial or ethnic group. And we're 2 times more likely to die from cervical cancer. And what my call to the world is we all need to find a way to make these numbers better.
Is this greatly preventable? Is this something that if we change our lifestyles, can women avoid this?
I mean, this disease is definitely preventable. It is early detection is your best protection, so make sure you're going into your doctor, doing your well woman visit annually. This visit includes a discussion and testing. So make sure you're asking your doctor to get screened for the most comprehensive method for your age. For example, Neil, if you're over the age of 30, you want to ask for co-testing. This includes a Pap test plus HPV, which can detect nearly all cervical cancers. And if you need more information, you can definitely go to hologic.com/wellwoman.
What about women that are younger? What age should women start getting screened for cervical cancer and being concerned, if concern is necessary?
The women the age of 21 to 29, it is so crucial that they are Pap testing. Mm-hmm. If you're 30 or older, you want to go in, like I said earlier, and get co-testing, which is your Pap and your HPV. And what happens is the Pap smear will let us know if there are any cellular abnormalities on the cervix. The HPV will detect any persistent strains that can develop into cervical cancer. And this is going in, Neil, one test, but one sample, so you get one exam, 2 tests that will detect nearly all of the cervical cancers.
You mentioned African-American women being at higher risk. Is there a genetic predisposition in some women to develop cervical cancer above and beyond lifestyle and the preventable measures that you can take?
We believe all cervical cancers come from, not all, but most, if not 99% of them are coming from HPV. So I can't say that as a genetic predisposition. As African-American women, you know, there have been multiple thought processes as to why, but not genetics.
You know, we've been hearing for many, many years about the importance of getting HPV vaccines early in children's lives. Are we seeing cervical cancer even with these vaccines?
Well, we are definitely still seeing cervical cancer. We see about 14,000 cases a year, so that's 1 in 3 women. So the one way to prevent it is to go in and make sure you're getting screened. Have your Pap test. If you're over 30, definitely have the co-testing, which is HPV testing.
What advice is it that you have above and beyond what we've talked about already for women to help them prepare for their annual exams and maybe some questions to ask their healthcare provider during that exam?
So, Nia, I like to have women feel like they're coming in to talk to their good girlfriend because we're typically open, we're honest, we're transparent. You want to make sure this conversation is very honest. You know, you're not going to get judged by us, but discuss all of your women's health issues. Make sure you talk about all those things on the top of your mind about your body. But the one thing you want to do is have the discussion. Talk about those things. Discuss. Ask questions. I've had this happening. It's been happening this long. Should this be happening? I've done this lately. Should I have this? So be honest. Talk to us about what the problem, how long it's been going, and what have you done different that could contribute to that problem.
When it comes to male practitioners, do you think that there is maybe more awareness and training needed on their part to better address some of these issues when their female patients come in to talk with them about such intimate issues?
Now, I'm going to say we're all trained the same. I just think that, women are women. And when we talk to women, we can definitely relate. I won't take anything away from male practitioners. I think they're wonderful. But when you're talking to your practitioner, male or female, as a woman going in for a visit, that is your time. That is your visit. Just be open, honest, transparent. Even the male practitioners, nobody is judging you. So I don't think they need any. You can never train a man to be a woman. But they are definitely properly trained to make sure they're getting the right information out and doing the correct screening. But as a woman, make sure you're asking for your screening. Make sure you're saying to them, I want to get my screening so that I can decrease or eliminate my chances of having cervical cancer or developing cervical cancer.
Where can folks go online and get some more information about cervical cancer and about you, doctor? Yes,
you can go to hologic.com/wellwoman to learn a lot more about Pap testing, and it also allows you to set an appointment reminder. And for more information about me, go to Instagram at @TheRealDrJackie.
And we can pick up a copy of your book, Queen of V, at most of the major online outlets.
You can get Queen V on Amazon, Barnes & Noble, and definitely go into my bio, and we'll give you more directions.
Well, Dr. Jackie, I thank you for joining us here on Health Professional Radio this morning.
Thank you, Neil, for getting this information out there.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.